Hi, it's the nursing professor here. I want to talk to you today about 3 viral illnesses that present themselves in somewhat the same way. So I want you to be able to walk away from this knowing similarities and particular differences that will help you answer questions. So the 3 that we're going to talk about today are flu, COVID, and RSV. All of them can present with some sort of respiratory symptom. They're all viruses. They all are contagious and pass by droplets from person to person. You know, somebody coughs, sneezes in their hand, they touch an object, person can get it that way. Or a person's in a group and the person is exposed to it. All right, so these are some symptoms of flu. Fever, cough, runny nose, muscle aches, headache, fatigue. This chief complaint here of muscle aches usually is the identifier about flu. Very similar is COVID. COVID, typically people have these symptoms, but along with it have extreme fatigue. The COVID virus usually ends with that. It also can result in blood clots. So those things we'll note the differences between the two. RSV is mainly respiratory. It attacks the lungs, and so these runny noses and body aches and things like that typically are not a part of RSV. As a person is absolutely miserable because they're having difficulty breathing. All right, so let's think about treatment. Treatment of flu, Tamiflu, antiviral, typically shortens the duration of the symptoms, which is usually 4 to 7 days. COVID, we have Paxlovid, which again shortens the symptoms, make them a little less severe in some people. The trick with Paxlovid is this: everybody can't take it, and we need to be aware of people who have underlying illnesses like renal disease, liver disease, previous blood clots, strokes. If they're on blood thinners or they have blood dyscrasias, that's not something that you want to have that person take if any of those happen. And then with RSV, then because it's attacking only or primarily the lungs, I'll say that, then typically that person is getting respiratory treatments like inhalants, oxygen supplement, IV fluids, things like that. So key difference in RSV as it relates to flu and COVID: RSV mainly affects people over the age of 60, and for every decade over 60, then a person is at an increased risk. Or babies, typically babies under the age of 2. Whereas flu and COVID is in our environments and pretty much can attack anybody. So how is this stuff spread? Coughing, sneezing, being in crowds, people coming to work when they're sick, talking, singing, eating in public places, all of those things. And so we want to make sure that if we're educating people, especially those that are at a greater risk, that we're mentioning those things. So what can we do? We can take those antivirals if they are recommended, but we can also prevent the spread. And prevention is going to include your old-fashioned hand washing, 20 seconds of hand washing, going in between your fingers, hand sanitizer if you don't have soap and water available, mask, especially if you're in a very close environment with a lot of people, air purification. If you're in an area that's closed and has poor ventilation, you might want to have an air purifier. And just instructing people that when they don't feel well, stay home, stay away from other people so that they can help prevent the spread. All right, bye for now.